Nurse Eckhart, tell me why your patient has hemorrhagic fever, queried Lassa fever, but his relative is going around him without a face mask. Why is the relative touching the line? Why, Nurse Eckhart? I didn't even ask you. You say it's because of ethics, clinical, but it's not true. Nurse Eckhart, why are your patient's relative exposed? Why? Why? Do you want them to contract it too? Nurse Eckhart, let's talk. Hello, guys. Today we'll be talking about the importance of ensuring the patient's relatives are protected in the hospital environment. We all know about hospital-acquired infections. It's real. But the truth is, it's not only your patients and the nurses and the healthcare practitioners that should be protected from hospital-acquired infections. Your relative is in hospital almost 24 hours, especially in Nigeria, where we know the patient's relatives do a lot of things for the patients. You know they are also prone to hospital-acquired infections. I do understand that you want to protect the privacy of your patients, but you should also protect the health of the patient's relatives. I know that there's a lot of argument about these things, about when your patient has some, infectious diseases, and those diseases, we know them: HIV, hepatitis, tuberculosis, Lassa fever, Ebola. We know that some patients do not want you to disclose it to their relatives that they have that particular disease or that particular infection. The truth is, you do not have to discuss it to the relative, to tell the relative, to give the relative some tips on how to protect themselves. Okay, the example I made the other time, a patient came into the hospital with hemorrhagic fever. There's a query of Lassa fever. Your patient's relatives need face masks. Everybody in the hospital is wearing face masks apart from the patient's relatives. That's very, very bad. That's not fair at all. You can just tell the patient, even if you feel like you don't have to tell the patient relatives the full details of what is wrong with the patient, then you can tell them that, okay, for health reasons, we would recommend you wear your face mask and use your sanitizer whenever you come in contact with this person or with the person's materials. Even though I do feel like in some cases the patient's relatives should be aware of what is wrong with the patient, especially when the patient is not conscious. Actually, whether you choose to tell the patient relative what is wrong with your patient or you choose not to tell them, the patient relative should still be protected. They should know what to do in an hospital environment. They should know to wash their hands regularly. They should know not to touch something. I mean, I see some patient relatives, they just touch the bin. That bin is labeled infectious waste. But because they want to throw away pure water nylon, they touch it. We know they should not touch it. I can never touch it because a lot of things are spilled on it. But they touch it. No, you should not let them touch it. Don't let them touch it. Tell them they should not touch the patient's IV line. Blood has spilled on it. The patient has hepatitis. Why are they touching the line? Why? As nurses, we know there are some patients we don't touch without gloves. We know there are some patients we don't go near them without wearing face masks because we are protecting ourselves. But how do you feel comfortable doing that when you see two people sitting beside the patient, a visitor beside the patient who is not protected? What is wrong with our healthcare system? Please, guys, protect the patient relatives, because these people will come in, they will carry something, then they will go into the streets, and this is how things spread. Let's be careful. There's a lot of things out there now. Let's not just protect ourselves, let's protect the people around us. Sincerely, you owe it to them. They don't have to be your patients for you to educate them. They don't have to be your patients for you to give them tips on how to protect themselves. So please make sure you do that. Thank you for watching my video, Nurse Eckhart. I hope you had a good time, and I hope you will change, Nurse Eckhart. Make sure you follow my channel for more Nurse Eckhart. Bye.